Well, hi everybody. I'm Tom Carper, Senator from Delaware, the first state to ratify the Constitution. And if you've never been to our state, please come. We have the newest national park, and we have more five-star beaches, I'm told, than any state in America. Spring is on its way, summer, so come and see us. I want to thank the National Association of Community Health Centers for the honor of receiving this year's Distinguished Community Health Champion Award. I think undeserved, but not unappreciated. So thanks for the recognition. I would just say to the folks on my staff, my team in Delaware, and my team in Washington, the folks that we work with, and the health centers across our state, I'm happy to accept this recognition on behalf of all of them. But nearly 50 years ago, when I was just a little boy, well, maybe not, but Congress began funding federally qualified health centers to expand healthcare access to low-income and disadvantaged people. Over the years, I've seen firsthand the vital role that community health centers play in our nation's healthcare delivery system. Today, community health centers fill a major gap in my state and in our healthcare system and across the country by providing access to primary care, so important, primary care, preventative health services for folks that are uninsured and underinsured in my state and 49 other states too. In Delaware, we have something called the West Side Family Healthcare. We've got La Red Health Centers. We got Henrietta Johnson Medical Center. They all provide in different parts of our state vital health care services to folks in those communities. The community health center model is one that can help Delaware and does every day, and it helps the rest of our country by transforming our healthcare system from one that takes care of people after they get sick to a system that provides medical homes for people with a focus on keeping people healthy in the first place. That's so important. Well, that's why long supported community health center expansion, strong federal funding for health centers. This is one of those deals that the Democrats and Republicans agree on, and that's a wonderful thing. There's not many of those. These centers are a proven example of how we can get better results for less money, too. Find out what works, do more of that. In addition to serving some 24 million patients across the country and providing a quarter of all primary care visits for all of our country's low-income population, these healthcare centers also save us a bundle of money, almost $25 billion each year, we think. The Affordable Care Act recognized the critical role of community health centers in our communities by investing over $10 billion in existing and new health centers across America. And I know that as we continue to increase access to health care for millions of Americans as a result of the Affordable Care Act, health centers will play an even greater role in ensuring that all Americans, regardless of their income level, regardless of their employment status, have access to good quality health care at a reasonable cost. I just want to thank you all for the work you do across our country in supporting community health centers and your commitment to providing quality health care to all Americans, regardless of their income levels, a commitment to serving others that we all share. I'll close with this. Some of you who know the New Testament pretty well have heard of Matthew 25. Matthew 25 talks about the least of these. When I was hungry, did you feed me? When I was naked, did you clothe me? When I was thirsty, did you give me to drink? When I was a stranger in your land, did you take me in? It doesn't say in Matthew 25, when I was without health care and my only access to health care was to go to an emergency room, my local hospital, did you do something about it? Well, in this country we have. In this country we have, and I think we have a moral obligation, regardless of what our faith might be, or whether we don't have any particular faith at all, we have a moral obligation to the least of these who live among us in all 50 states. And while we have that moral obligation to the least of these, we have a fiscal imperative to meet that moral obligation in a fiscally sustainable way. And one of the great things about our community health centers is it helps us meet that moral obligation, but it does so in a fiscally sustainable way. That's a win-win situation for them, and I think for our country. Thank you. Keep up the good work. God bless you.